Hey guys, it's Luke with Bag 9 PT and Performance. Today what we're going to look at is hip mobility. Now the tests I'm going to show you are some of my favorite to assess this area and some of the most important when it comes to the golf swing. So we know we need to move well through our hips and our T-spine, and then if we start going from there, I'm thinking shoulders and neck. Those four mobility centers are the top ones. I think if you take a look and watch what we do today and then watch our thoracic spine video and then kind of assess yourself, and then go there, kind of use our exercises, 10 or 15 minutes a day is going to make a huge difference in your game. So one way that I will always assess this is called the lower quarter rotation test. So what I'm looking at is I have a little setup for like a 60-degree angle. I'm going to have the player standing in front of me. Let's say we're standing on our right side first on my trail leg. Soft knee, just relaxed here, hands on my hips. I'm going to rotate as far as I can and see, does that player get past the 60-degree mark? If they don't, I know, hey, that's another area I need to dive in and check passively. And I'm also going to do another seated test that you'll see that's one of my favorite. So I also will do external here too. Most people don't have issues here. I would have a 60-degree kind of angle on this side as well for you to see that. And again, I would do the same here. So this is external rotation for my lead hip, and then I would check internal and go there. So that's an easy screen for us to tell, first off, is there likely some hip mobility stuff going on? Let's dive into that further. If they're having low back pain, you know I'm going to be looking at your hips because they're usually a huge culprit for that. And low back pain is probably the most common thing I treat in my clinic as well as on tour. So we don't want to neglect those. But this is the step one. Try this out, give yourself kind of a passing or failing score, and then let's go check out the next test and see where you stand from there. Now we're going to look at one of my other favorite ways to assess hip mobility for my golfers. So this time we're going to be in a seated position. Normally I like the feet to be hanging, but we can get away with it, feet on the ground right now. Hands are going to go on our hips so we can try to keep from like cheating. What I want you to do, I want you to try to take your foot out as far as you can without hiking up the hip or anything. So just kick it out. Then I'll even have my player kind of go in, boom. Then I'll check the other side. Can we go out? Boom. Can we come in? Now, as a practitioner, I'll measure from the front with a goniometer, or I'll use some like Vald dynamo to test it to get some like actual numbers, because this is something I'm going to track. So I like to do it seated here to get some baseline numbers. I really want to see at minimum for internal rotation about 30 degrees. External, I want to see probably 40 degrees, but in reality, I want that internal to get closer to 45 degrees because that's truly what we're going to need when we're talking more in standing and trying to load into that back hip and our backswing for right-handed player and getting through to our lead side hip as well. So 45 degrees is like the magic number. We got to have a minimum of 30. Otherwise, we're going to have issues, and a lot of times it's that lower back talking to us. So try those out. Let me know what you think. And if you find that you're limited, please go through our channel. I've got a ton of exercises to help you get better at your hip internal rotation. Anywhere from our 90-90 mobility stretches for the hips, as well as how to strengthen that internal rotation with some of our videos as well.